listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me on today's episode of Simple Health Radio. This is Dr. Emron, your host. On today's episode, I wanted to discuss a very scary illness that has been developing since 2014. It's been primarily affecting young children who were perfectly healthy, and it's gotten a lot of media coverage lately. The medical term is called Acute Flaccid Myelitis. So Acute Flaccid Myelitis, the abbreviation is AFM. Now, basically, what happens in people who get AFM is that they develop a polio-like illness. What that means is the person could be completely healthy, have no medical problems whatsoever. They might get sick with something, and then suddenly they become paralyzed. And they'll develop severe weakness in their face, in their eyes. They may have trouble swallowing or eating, and they lose the function of their arms or legs. This is very, very alarming because it's occurring in people who have really no risk factors. And there hasn't really been a clear answer as to why this has been developing or becoming more common. Now, the CDC, which is the Centers for Disease Control, they launched a task force this year because of the number of cases that were increasing. And that's what I'm going to talk about now, is some of the history based on the limited information that we have and some of the progress that's been made regarding it. Now, the AFM, which is acute flaccid myelitis, it's estimated that in 1 million people, only 1 or 2 will develop it. So it's exceedingly rare. Since 2014, the patients who developed it seem to have had a viral illness just before they became paralyzed. So this could be a mild, kind of an upper respiratory infection, maybe a cold, maybe a fever, maybe flu-like illness that would resolve, and then a short while later, these new symptoms would develop. The most common symptoms that people had was the sudden loss of arm strength or leg strength. They would lose muscle tone, which is where the flaccid part comes from, and they would have facial drooping or weakness. They would have trouble with their eyes. They wouldn't be able to move their eyes. They would have drooping of their eyelids. And many children or adults would have swallowing issues or slurred speech. So some of these symptoms all look almost like a stroke-like pattern, but they're in children, which is not supposed to happen. And some people will develop polio-like symptoms, which again is not supposed to happen because a majority of people are vaccinated against polio in the United States. All of the people that were tested for polio came back negative. So since 2014 through 2018, every single polio test on those people was negative, even though the symptoms looked identical to polio. Now, some people reported numbness and tingling. Other people had difficulty urinating. So they either had urinary retention, meaning they couldn't urinate, or they had other issues in managing their urine. And then the severe cases resulted in respiratory failure. Those people required ventilation. They had to be on a breathing machine, and some of those people didn't recover, unfortunately. Almost all of those cases that became severe required hospitalization, and that led to other complications. Many specialists were involved. Neurologists, which are brain specialists, have been involved. Infectious disease doctors have been involved. But it's been a challenge. There's really no clear link as to why this has been happening. Now, all the testing that people have done, including MRIs, labs, spinal taps, and so on, so far has been normal. There's no evidence of a clear link between a certain virus or bacteria or fungus causing those symptoms. There are some theories, however. One is that a polio-like virus may be causing it. There's something called enterovirus, which could be causing it. There could be a West Nile virus, which is transmitted by mosquitoes. I did an episode on that about a month ago. But the testing is inconsistent. About 80% of people have tested for some virus at some point in their body, including Coxsackie virus and some of the common cold viruses. But again, not all people who have a cold virus are going to develop this AFM, basically. Now, the other issue is that there's no way to prevent it. So because we don't know which virus or bacteria is triggering it, there's no vaccination. So people who are exposed may have it, and we have no way to stop it from progressing. It's only after they become sick with the paralysis and they become hospitalized can any treatment really be done. And at that point, it's too late because there's no way to really cure it. We have to just monitor and do what we can to keep them comfortable, prevent complications, including those breathing issues, prevent other side effects from treatment as well. So again, the AFM is very, very confusing. The other issue is that it seems to be peaking every 2 years. So 2014 were the first reported cases. 2015, very few. 2016, higher cases. There were 134. 2017, very few. And then 2018, it spiked again. So there's over 158 cases as of today that have turned positive for AFM, and we still don't have any answer. So this illness has been around for about 4 years already. No clear link, no clear pattern, and that's why many people in the media have been talking about it and trying to determine what other issues need to be handled. The CDC this year launched the task force. We're still waiting on their results and some of the treatment guidelines, but for the most part, they've really said just carry about your business on a regular routine pattern. Don't change anything about your eating. There's no link with the vaccinations, and that's as much guidance as we have. So if you hear about AFM on the news and it's a polio-like illness, this is what they're talking about. If you have some information about it, or if your family is worried that you may be at risk for it, talk to your doctor, and they can hopefully guide you through that. I'll have some additional information on our website, and you can share it with your family and friends. Please follow us on social media, and hopefully we'll have you again back on a future episode.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 and Out Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.